Good morning, dear colleagues. Welcome at this webinar. We will start in 2-3 minutes from now. For your information, this webinar will be recorded and it will be available after the event. Your microphone will be muted to guarantee a bit more quality during the sessions. And for questions, please use the Q&A button on the control bar. You also can share opinions, agreements and disagreements using the chat box. So we formally start in 2-3 minutes from now.
Good morning.
Good morning, Mr. Shikluna. Is that more or less correct pronunciation of your name?
Shikluna, that's much closer than most.
Okay, thank you. Thank you. Thank you.
Thank you. I'm sorry for joining late, but I had some technical difficulties on the way in.
No problem. No problem. We will formally start in 2 minutes from now. People are joining us. Welcome, dear colleagues from across the European continent. We will formally start this webinar on the emergency situation that we have again in our sector. This webinar will be recorded, as you see on the screen. Your microphone will be muted to ensure a certain level of quality. And for questions, you can use the Q&A button, or you also can share your opinion, your agreement or disagreement in the chat box. So a bit of patience, 2 more minutes, and we formally start. People are still joining us from across the European continent. And it's with pleasure that I can inform all participants that we have high-level participation of the European Commission. We have Mr. Colin Shikluna with us, head of the Switzer cabinet, and that is a cabinet which is of extreme importance for our sector. We start in 1 minute from now. Good morning, dear colleagues from across the European continent. Welcome at this webinar during which we would like to discuss the impact of the second COVID-19 wave, the impact on services that support persons with disabilities. For a moment, we thought during summer that the worst was over, but the opposite proves to be true. So that's why we thought that it is important to have another webinar, listening to your stories, listening to your testimonies, and trying to develop the appropriate actions and activities to support you. I will be your moderator for today's session. I'm Luc Zelderlo, Secretary General of ESPD, and we have lined up, I think, a very good group of speakers. We have with us, of course, our president, who will open the event formally in just a few seconds. We have a high-level representative of the European Commission. We have the head of the Switzer cabinet with us. Vice President Switzer is of major importance for our sector. And then we will have testimonies from the different sub-sectors in our disability services sector. And the Vice President of ESPD, Karin Asteger, will draw some conclusions at the end of the event. You have seen the program and you have seen the technical guidelines. This webinar is recorded. Your microphone will be muted during the event to guarantee good quality. And if you have remarks or questions, you can use the Q&A on the control bar or the chat box. And for those that would like to have in real time in text what is discussed here, you can go to the captioning button, closed captioning, and there you will have in writing in English what is discussed during this event. It might facilitate following and understanding what we are discussing here. So again, welcome, dear colleagues. And now I hand over to the president, newly re-elected president of ESPD, Mr. Jim Crow. Jim, you have the floor.
Thank you, Luke. Good morning, dear colleagues. Bonjour, buenos dias. Good morning, dear colleagues, and our important guest, Mr. Cicluna from the Commission. The title for our webinar today has been carefully chosen. We mention the word in English, emergency. And that, dear friends, I'm afraid, does not understate the depth of the challenges we face, both as a society, a European society, but also as service providers supporting people with disabilities. For me, when I was thinking about this seminar today, I was thinking of two huge ironies. The one which I will spend most time on in my few minutes is regarding services. That's the first one, the first irony. I'm sure we have all looked on, first with horror, then with admiration and emotion, at the images we've seen or the experiences we've had of nurses and medics fighting to preserve lives. This virus is truly cunning, devious, and ultimately very damaging and dangerous. But perhaps when we've looked at those images of our colleagues in health services, what's not been so obvious is the many workers in our services, the services that support people with disability who are not labelled as being health services, but where our workers have been confronted with equally traumatic situations on a day-to-day and an everyday basis. Whether it's to start a shift in their organization without any protective equipment, knowing that they might be putting themselves and their families at risk and their loved ones at risk through their work. They've also had to play a hideous gatekeeping role, trying to explain perhaps to the autistic person that they support, or a person, say, with a learning disability, why they cannot see their parents, see their friends, and similarly, to bar the way for parents and relatives and loved ones to see their close relatives through these traumatic days. And I do have to draw a contrast. In most of our societies and economies, resources for people working in health services have often been thankfully free-flowing and not subject to financial controls. And that's as it should be, entirely as it should be. But for the people running and managing our services supporting people with disabilities, have seen their funding base often become more unstable, reduced, or cut completely as a product of this crisis. So that was the first irony. The second irony concerns people with disabilities themselves, the people we support. The crisis has led often to them having less choice and control over their lives. Dangerously and frighteningly, it's leading to the reinstitutionalization and remedicalization of services. And this is a terrible and tragic irony in the light of the UN CRPD. So that is our context. It's a very worrying and frightening context. And I will now hand back to Luc Zeldrou. Thank you.
Thank you very much, dear President. Thank you very much, Jim, for this opening statement. Indeed, very difficult times again. We've, as I said already, for a moment thought that the worst was over, but that seems not to be the case. And I'm sure most of us welcome the news about the developments of vaccines, but the same moment we started thinking about who will get the vaccines first, and will the vaccine go to people that we support and the people that work in our services and they do the supporting work. So together with the good news, also another concern popped up, so to say. I would like to hand over now to Mr. Colin Scicluna, who is the head of cabinet of Suiza, the Vice President of the European Commission. And Mr. Colin, can I say Colin, is that okay for you? Colin, thank you very much for joining us. It is very important that we have a strong involvement of the European institutions in deciding on how to handle this crisis. So we really look forward to the message you want to share with us. And also thank you very much for making yourself available for a very brief Q&A right after your statement. Thank you very much. Mr. Scicluna, you have the floor.
Thank you. Thank you very much, Mr. Zeldrou, and my greetings to all out there. Teslima speciali l-ħbib min Malta. You'll forgive me for using my native language. It's quite rare that I get the opportunity to do that. First of all, I'd like to give greetings on behalf of the Vice President herself, who apologizes for not being able to join this webinar. But you are assured, I think, of her own personal support and her own personal engagement in these issues, and I think especially in making sure, or trying as far as we can, to have an approach which is a joined up approach, because I think that in a crisis like this, this is crucial. It's crucial for your sector, and I have a lot of appreciation for the very sobering picture that President Mr. Crow has just presented to us, because it is an accurate and sobering picture. But of course, and I know that you appreciate this, there are many competing demands on the resources that are available. Now, I prefer to think in terms of addressing those demands rather than prioritizing, because I'm sure everyone can present themselves as being a priority case, but I think that that's not the point here. I think the point is that we look at what resources we have available, we look at how we can deploy those resources most effectively, and more importantly, that we direct them towards those who need those resources the most. Now, within the Commission, we tend not to speak about the second wave, for the simple reason that our approach has been throughout that this crisis never really went away. We had perhaps a dip during the summer, we had some relief over the summer, but in reality, it was very clear that we were heading towards the situation that we find ourselves in. And I think that many of the things that we have done, many of the initiatives that we have put in place have been with this longer term vision in place. I think the good news, if we can call it that, is that we have learned some lessons from the earlier part of this crisis. And I think the most important one of all is that member states of the EU have learned that going it alone does not work. It simply does not. At the beginning, we all know what happened. Everyone was closing borders, was instituting their own ways of addressing different aspects of this crisis. Happily, this is far less the case now. There's still a lot of coordination that needs to be done, but I think that we have reached a point, and we saw this in a number of the meetings that were held at the level of leaders, where the leaders, the prime ministers, the presidents of our member states acknowledged that we needed to do things together. And many of the successes that we have are on the basis of the fact that where we worked, managed to do things together. You all know about many of the things that have been done have had a direct or indirect impact on your sector. Again, much more can be done, needs to be done, and will be done. But I think it's worth taking note of the things that have been done and have been done in an effective manner. First of all, we had the what we call the CRI, this Corona Response Investment Initiative, where unused funding was redirected to the areas that needed it most. And your sector was one of the sectors that has benefited from this. And any of you who know how the European Commission works will appreciate that it's no easy task to redirect funding from one place to another. It usually takes months, if not years, to do that kind of thing. And here we managed to do this extremely quickly. It was the first and most visible, I think, reaction that we had early in the crisis in the spring. Many other aspects were towards releasing funds, other funds, and of creating new funds to be able to help member states, because very often it's the competence of member states, not of the institutions themselves, to be able to address the needs. And in fact, at the moment, we have, as part of the budget, as you may be aware, at the moment we're finalizing the budget for the next 7-year period. And this budget has been devised in a completely different way to previous budgets, because this is very much a crisis response and recovery budget. And we are now at the phase where we are working with member states to draw up their recovery plans. In most of these recovery plans, we see a very strong emphasis on social services, broadly speaking, but the care sector very, very particularly. And there, I think you all have had and have a role to play in ensuring that your governments give priority to this sector. But I think that in most cases, we see that this is the case, that there is an awareness of the need that exists in your sector. You mentioned the vaccine, and it's true that we've had good news. You're right as well to say that the good news always has ifs and buts, because first of all, having a vaccine that's ready to go onto the market is only the first step. It's a great step. It's a wonderful step. But then you also have the logistics. You also have the distribution of getting this vaccine to those who need it the most. Our position throughout has been that we need to prioritize those who are in the front line. And those who are in the front line are those, broadly speaking, in the care sector. So whether it's healthcare, whether it's disabilities, whether it's the elderly, that all of these sectors need to be given absolute priority, because the workers in this sector are the ones who have been literally risking their lives from day one in this crisis, while many of us have had the luxury of working from home, of adapting our lives to this reality. They have not had that luxury, and it's very important that we keep very much at the forefront the fact that these sacrifices have been made, that these risks have been taken for a very, very noble cause. So this is something that is certainly very present in our thinking. The Commission's position has been at various points that priority needs to be given when the vaccine is available for distribution. communication is extremely important as well. I think it's very, very important that we have this kind of two-way discussion. We have had a number of these discussions, and I think that Vice President Schweitzer herself, you may recall, had taken the initiative to bring together the various commissioners who are involved in this sector, from the social angle, from the equality angle, from the healthcare angle, and coordinating and marshalling all the different efforts that we have to be able to have a comprehensive and a consistent and a directed approach, because the means are there. But very often it's about deploying those means in the right way. And I'm grateful that at the way that we've had this interaction together, because I think it's a very good example of how sector and the European institutions can in fact deliver results together. It doesn't mean that we're going to be able to give you or provide you with everything that you need and everything that you would like to have. I think that is understood. But at the same time, where we can, it's important that we are aware of what those needs are, because you are the ones who can make us aware of those needs much more than we can guess or imagine, and to direct the efforts in the right place. And I think that even in the contacts that we have been having with our member states, we have made it very clear how important this is for us. Ultimately, it will depend on them. But I think it's good that they're hearing this message from both directions, from yourselves in the sector, but ourselves as well from the European level. We have a number of other initiatives which are coming up in the coming months, and which will have a direct impact in the context of COVID-19, but also more broadly, because I think it's also very important that the lessons that we are learning through this pandemic are lessons that we can apply in a broader context. It's not just about stopgap measures to deal with the situation we have today. Of course, those need to be done, but we also need to try to adapt our thinking for the longer term, because these are problems which may crop up again. These are situations which will continue to challenge us, and I think that it's very important that we strengthen the measures that we have available to be able to cater for this kind of situation. One of the first initiatives that we have is in January we will be adopting a green paper on aging. Now, green paper on aging is a very broad product, but of course the disability sector, the care sector, will find a very, very important place in this product, because it's something that we feel the need to highlight, and rightly so, because I think that it's a very important part of the attention that we want to give to this exercise. Perhaps just if you'll permit me to clarify a little bit, but when we talk about a green paper on aging, we're not talking about a green paper on the aged, on old people, not only. Aging is something that we're doing our whole life. It starts the minute you're born. So we want to look at this from a life cycle perspective. And there again, the disability sector is a very important element, because it's something that not only is the general population, let's say, living longer lives, but even disabled people are living longer lives. So this in itself is an angle that we need to take into account. As you know as well, probably we have the action plan on the implementation of the European Pillar on Social Rights, which will also be coming will be produced in the first quarter of 2021. Again, this is something that is broad, but will certainly have an angle which will focus very much on your sector. There will be a disability strategy, which I'm sure that many of you are aware of, and obviously are also involved in your own way in the devising of this strategy, and this is something which is an important milestone even for the European Commission. And as we have mentioned on a number of occasions, we are looking at what might be able to be done on the care sector more broadly. It's difficult to say specifically what it is we will come up with on the care sector, because we need to see a little bit what the broader needs might be, what COVID is bringing with it, and changing the sector, and therefore the way in which we need to address this. We need to talk to member states to see what their asks are, because this is something where we cannot work by ourselves at the European level. We need to know for sure that we have buy-in from member states, and it's important to note that not just member states in terms of the national governments, but in many cases you need to also involve regional authorities, because this is in certain countries this is something that is a devolved responsibility. So it is a more complex context, and will need to be addressed in the right way. But certainly there is a commitment to follow up on this in the future.
Mr.
Cicluna, yes.
Is it okay that I slowly open up for a brief Q&A?
Yes, I was just about to conclude.
Okay, sorry. Please conclude.
No, I was just going to say I will stop there for the moment, but I'd be very happy to take a couple of questions and try to clarify where I can.
Perfect. And again, I really would like to thank your cabinet for the openness and for the very good and active communication we have had over the last few months. Indeed, at the very start of the crisis, together with your vice president, we organized an important event that brought together all the relevant actors from our field, from the sector, and we discussed how the European institutions could support and empower our sector. The Corona Response Investment Initiative and REACT-EU, I think, are indeed important milestones there, although the real impact still has to be seen, because that comes a bit slow, I must say. We also have the recovery plan, where there might be some opportunities for us, and also the recovery resilience facility might help us a lot. But let's now see what type of questions we have from here and there. I will give you a few, Mr. Cicluna, if that's okay. There is a question with regard to maybe guidelines that the European institutions, the Commission could provide with regard to the distribution of vaccines. In our sector, over 10 million professionals are employed, and as you know, quite often, and during this so-called second wave, indeed, it never went away completely. We see that there is a lot of sick leave in the services now, and that is making it very difficult to provide high quality and personalized, individualized support. So will the Commission provide guidelines on the distribution and maybe prioritize persons with support needs and their support workers? There also is a question with regard to triage. We see that in some countries the health system is close to a saturation, and we see that triage in certain areas of Europe started again, where disability is also used as one of the reasons not to provide access to certain intensive care facilities. That is really very, very worrying, and we would like to have your views on that. And there is also a question with regard to the preparedness for the future, because indeed we are in a certain crisis now, but it is almost guaranteed that we will have similar crises in the future. Maybe not based on another virus, but crises will come now and then. And what will the European Union do to empower also our sector to deal with these unexpected situations? Maybe a brief reaction from you, and then after that, I would like to ask our president to ask a question himself also to you in a way representing our sector. Please, Mr. Cicluna.
Thank you very much. They are very very pertinent questions, and they are questions which are also very much on our minds, both as policymakers, but also as citizens, because I think it's very important that these are issues that are also in the broader discourse, and I think it's important that awareness is raised about these very very important matters. I think the key word here, if I had to choose one, is guidelines. And the reason for that is because, as I've mentioned, the competence on many of these issues lies with either national governments or regional governments. and the EU cannot itself legislate in an enforceable way on many of the issues that you mentioned, whether it is the question of triage, whether it's the question of vaccine distribution. However, what we have been doing throughout the crisis and on a number of elements linked to this crisis, not just those which are of interest to your sector, is to issue a series of guidelines. And these guidelines are, in general, they are best practice. And what we are doing is we are encouraging member states to operate, to act in the following way, and to give certain standards that need to be taken into account. On this, we've been working also, for example, in this particular sector with the ECDC, which is the transmittable disease agency of the European Union, and where there have been very regular guidances and guidelines issued on how member states, how authorities, health authorities should be operating on various aspects linked to the COVID crisis. And I would say that in the vast majority of cases, in fact, this guidance is being taken on board, because it's guidance that's coming from experts, it's guidance that's coming from pooling together the experiences that there are in different parts of the EU. In reality as well, the experts themselves, we have helped to create networks of experts between different member states, and the people who are advising governments on the epidemiological situation. And it very often it's also from that advice that we are able to give guidelines to the member states. Ultimately, though, it's up to the individual authorities, whether at the national or the regional or even local level, whether or not they apply that guidance. And we cannot force them to do that. But as I said, I think that the experience has been, in general, that there is quite a degree of observance of that guidance. With the particular case of the vaccine distribution, here it's a slightly different situation because, first of all, the European Commission itself has become an active participant in the development of vaccines, because we, together with member states and with the, let's call it, the permission of member states, we've funded research. We've actually chosen certain research efforts and provided funding to them. And one of them is the one that made the announcement just a couple of days ago, the one from BioNTech and Pfizer. Also, we have signed agreements with a number of companies, including this one or this joint venture, to already pre-order vaccines. And we have made it very clear that the vaccines that the European Commission acquires are going to be distributed to member states, one, in an equitable manner, and two, with certain criteria and certain priorities in mind. And as I mentioned before, one of those priorities is that the frontliners, that the care sector, are the ones who need to be, let's say, the first recipients of the vaccine, or at least have access to the vaccine. So there we have, let's say, a bit more influence on being able to push this idea. Of course, we need to work together with the member states. This is not something that we can do by ourselves. And I also think, in looking at what is being said in various of the member states, most of the health ministries and the health authorities want to participate in this joint effort, because they see that they are more likely to have a quick access to a stock of vaccines in this way. And I'm speaking here especially about perhaps the smaller member states, or the member states that may have less resources available, and they see that in joining in a European-wide effort, they have a better chance to get the kind of stocks that they will need. Maybe just one word on future.
Yes, please, very brief. Yeah.
you know, we are, as I said, we're learning lessons, and I think that we are in parallel to doing what we can to deal with this crisis in the immediate, in the here and now. We are also putting in place a number of systems that will be able to help us in future crises, whether it's pandemic or other forms of crisis. And I think that we will see that certain things like joint procurement, like joint research, these are things that we will continue to strengthen.
Okay, thank you very much. And again, I would like to re-emphasize that we as sector representatives are 100% available to further develop these instruments and approaches. Dear President, your major concern and request to the European institutions. Please, Jim, you have the floor.
First, Mr. Scicluna, I wish to thank you. It has been evident to us in ESPD and in our colleague disability networks at a European level that there has been a much stronger engagement from the Commission and at political level from the European Union. So we do acknowledge that, and I'm sure you played no small role in that, Mr. Scicluna, so thank you. We do appreciate it. I think, however, if one looks at the report, which we'll be presenting slightly later, the dilemma that the Commission has, you put it yourself, Mr. Scicluna, you've said it's not always easy either from a point of view of legislation or directives or of tracking cash to make sure that it gets through to all the places you would like to see it to get through to. But our report is quite worrying. It's saying that even 6-8 months after the crisis first struck, very little of that, if any, of that money, new funding, which the Commission has been very good at working to develop, has found its way down to a local level to social care organizations. So I hope that quite often holding cash and delivering cash does give powers, does give influence. So I hope you will find some even more creative ways to deliver that or influence the delivery of that funding down to a local level. I would also ask you, you've set a huge example in terms of collaboration and working together, and that's been very evident in a number of initiatives, like transfer of hospital patients across borders, like the joint initiatives on purchase of equipment and on vaccine research and development. But please don't forget the accession countries, the countries that are outside the borders of the Union. Again, you can play a very influential role, particularly through structural funds, in assisting some of those countries whose economies were in a very poor state before the crisis. But you can help to play a constructive role in assisting people with disabilities outside of those physical borders. So I don't know whether my comments are a statement or a question, but please, if you have any further thoughts, we would welcome them, Mr. Scicluna.
Yeah, thank you very much, Jim. And like all good lobbyists, the statement is a question and the question is a statement. Mr. Scicluna, maybe a final very brief reply?
Yes, no, thank you very much for that. What I can say is that on the creativity, I can assure you that we will certainly try to be as creative as we can to try to address these issues. And I think that this is why it's important that we are working together, because I think that you have a very important role in raising the visibility of these issues. I mean, for example, if we think of the images of the COVID-19 crisis, or what we've been seeing on the news, on social media, etc. As a private citizen, I have not seen as much as I would have expected on the disability sector. We've seen a lot about elderly people. We've seen a lot about the needs that hospitals have. We've seen a lot about various aspects of it. But I think it's important that to attract the kind of attention that you need perhaps raise the visibility of.
Yes, indeed.
Maybe it's unfortunate to have to say this, but we do live in a media-saturated environment, and this is something that perhaps needs to be taken into account. On your second point on the accession countries, I can say that we have approached this the crisis very much not only in terms of the 27 member states, but very much in terms of 27 plus. And the candidate countries, the accession countries, have, especially the countries of the Western Balkans, have been very, very much part of the solutions, part of the measures that we have tried to put in place, and I think I would say in pretty much equal measure to the EU member states. So I think there we certainly have responded to that in the manner that is the right one, because I think that this is the way it should be. This is Europe plus and the Europe of the future. So important that this is taken into account.
Thank you very much on behalf of ESPD, Mr. Scicluna, for your presence this morning and for your very useful contribution to the debate and to the empowerment of our sector. We are available for future cooperation. And I also hope that it is possible for you, or at least some of your staff, to stay with us for the rest of this event, because we will share more data, more information on what is going on at grassroots level at this very moment in services, support service for persons with a disability across the European continent. I also would like to draw the attention to all participants that in the chat box you can find interesting links and information on policy initiatives taken by the European institutions. You can also find some material of what the United Nations and the World Health Organization are developing with regard to the response to COVID-19 for persons with disabilities. So next to an interesting debate, we also try to provide as much as possible useful information to all of you, so that at grassroots level you can benefit from this. Let's now turn to what is going on. And as an organization, we issued the first COVID-19 report a few months ago. We updated that, and it is with pleasure that I hand over to Thomas Bignell, now Policy Manager of ESPD, who collected this material, and he will present it now. Tom, you have the floor.
Hello, everybody. Can you see my slides?
Yes.
Perfect. So I'll come back to the start. So as Luke mentioned, we did a first, let's say, snapshot report on the impact of COVID on disability services in Europe in April 2020, which was for most countries in Europe at the beginning of the first lockdown period. And what we did now is to do a follow-up to that report to see what is the state of play in October 2020, either as part of the second wave or, let's say, the long-term consequences of the first wave. This relies on data that we collected within our organization's member forums, so our working committees, which cover different themes within our activities. And of course, what we try and provide is a general state of play across Europe, but we cannot really, cannot really in detail reflect the varying circumstances and complex diversity across different parts of Europe, but also within each member state. As you mentioned, as Mr. Scicluna mentioned earlier, regional authorities, for example, have a lot of power. So of course, the differences in responses are very varying, but we hope to show the big picture. First of all, maybe a quick overview of what was the situation in April in order to compare with where we are today. What we saw in April was that besides residential care services, most other forms of services were either closed or primarily provided online, and residential care services were the only ones which were sort of primarily continued. Then in terms of the main issues that we highlighted at the time, one of the biggest ones was insufficient access to personal protective equipment in over 75% of the responses that we received. We have also a use of extra hours, so additional staffing hours was the biggest, let's say, impact. Around 50% of our responses mentioned a decrease in income, and then on top of that, just under 25% noticed unstable income. So that was, of course, a very worrying picture, both in terms of, let's say, the fact that most services besides residential work were closed, and the impact that has on the lives of the people that we support, but also on those of let's say, the family members or others or surrounding people that we help, has a major impact. And so where are we since then? And I think we hear a lot of negatives, of course, and that's, that is very difficult circumstances. But I think what we can show both pride and respect for is that since the first wave, most of the services are now being reopened, including in forced face-to-face format, meaning that back in April, many of the services were closed for a variety of different reasons. But since then, in the months, we've made significant progress to allow us to provide those services face-to-face. And that, of course, is extremely important for the well-being of the people that we support, and also to allow the people that we employ to do their activities that they often enjoy more than just a job. And this is in large part because we've managed to adapt our services in a quite flexible way through digital means, better learning how to provide support with physical distancing and the availability of personal protective equipment. So that's been a major change as well. Now, in most situations, not in all situations, but in most situations, we have enough masks and so forth to provide the support that is needed. Yet, with this second wave or ongoing of the first, the situation remains very unstable. And as was highlighted, what we've seen is that, in fact, the crisis has really reinforced or strengthened pre-existing challenges that affected our sector. The sector was already, let's say, suffering, I think it's probably actually the right word, suffering from underfunding in many countries, not fully recovered from the 2008 crisis, but also in the countries which are more richer, still in those countries, there's still underfunding to make sure that we can provide services in line with the UN Convention, training of staff, paying decent salaries, etc. And what we see with this crisis is that has continued. Existing difficulties have been reinforced. There are many increases in costs. So we have opened up the services, but this is at a cost, meaning that we've had to buy personal protective equipment, we've had to buy digital equipment, we've had to adapt the infrastructure that we're working in, we've had to employ more staff. But are we being covered by the public authorities for those additional costs? Not in all circumstances. And I think actually there are very few circumstances where I've heard of all those costs being covered. And at the same time as this increased costs, many of the services have had a diminished income, either because they're no longer fulfilling to the letter the contracts that they had with their local and regional authorities because of the consequences of the crisis, or because other forms of fundraising, such as charitable donations, have decreased, with many charitable donations going more towards, let's say, the healthcare sector and less towards disability services. Or it could be because other sources of income, such as linked to social enterprises, have had cuts to their income from selling products and services on the market. This is more the social enterprises type of activities that our sector often does, which sometimes can cover costs for other types of services that are provided. So financial sustainability of the sector is at risk. Also, staff shortages, increased absenteeism, sick leave, mental health support, and staff departures are very difficult. And we see that actually, for example, in the care services that many of our members provide, quite a lot of the staff are now going towards or picked up by, let's say, the healthcare, the hospitals, partly because of the need that is there, but also because of, let's say, maybe the higher salaries, the higher contracts that can be done there, which means that staff leave the social care sector towards the healthcare, which of course is important for the healthcare, but creates many difficulties for social support. So both these two elements, funding and staff shortages, are really challenged in this period, despite the reopening of the services. And the continuity of the sector is really at risk in some situations, at least. And maybe that's more, let's say, on the ecosystem, the background of social services. But when we're looking at the types of services that are being provided, we see that the emphasis on protecting, let's say, vulnerable groups. We also hear, okay, let's reopen the services, reopen the economy, reopen things, but let's protect those who are most vulnerable. And that's, of course, very important to protect people, but that shouldn't be at the cost of the ability of people to have choice and control over their own lives. And that includes persons with disabilities, and in particular, choice and control over the services that they use. And I heard recently an example where a person with a disability wanted to work, but could not work because the employment services and the family and their family decided that that person could not work. Sometimes it's down to legal requirements, sometimes it is not. But you have to be very careful about overprotecting people and not allowing them to make choices for their own. We mentioned earlier the danger of over-medicalization in the response to COVID-19. And I think here there's often a misunderstanding between improving access to healthcare for persons with disabilities. That does not intrinsically mean medicalizing the social support systems that do them. That can be done separately, or at least it should be looked into in that way. And there was earlier a question, I think, which should be brought up here as well, is the question of triage, where some people with disabilities may have less access to healthcare than other people because of their disabilities, rather than what is their human rights. So these are major issues in terms of how the services can be provided. So what's needed? Well, first of all, services continue to need to function. We need to avoid the lockdown of services, the closure of services as a priority, because we saw the huge social cost that had for the people that we support. Services need to continue to provide more choice and control to the people that we support. So avoid overprotecting people, but still allowing people to have choice and control over their own lives. But of course, this should be done in a way that still protects the health and safety of both the people and the workers. In the right circumstances, it's not mission impossible.
Can you conclude, Tom?
I will conclude. It requires adequate funding. It requires helping support services to recruit and retain staff. It requires prioritizing access to personal equipment, test and tracing, and the vaccines, as we mentioned earlier. And very often, the social care sector or the disability services are seen as secondary to the healthcare sector within, let's say, the prioritization of these protective equipment or vaccines. This should not be the case for various reasons that we have mentioned already. And of course, we need to help the services to adapt their services. As for the EU has been very active in many ways, but how has it really helped our sector specifically? There's been more flexibility to the EU fiscal rules, which have allowed regions to spend more money. And that's clearly very positive because it's allowed some regions to be able to help the financial costs of service provision. But there are big concerns over the medium to long-term focus on these EU fiscal rules. Will they become strict? Again, will this lead to further austerity to our sector? State aid has been very useful to support SMEs and big companies. There's little evidence of it's really supporting disability services for different reasons. We need guidance in public procurement due to many authorities remaining too rigid in their understanding of public procurement rules. This is an EU competence. The EU funds have made, I think, quite a lot of funds available. But right now, they're not reaching our field. So how can we bridge this gap between the funds that are available and our sector? And maybe a support center and help desk is needed to improve this process. Lots of ambitious social policy agenda for 2021. Lots of work ahead of us. That's of course very positive. Will they take into account the learnings from the COVID-19 pandemic? And especially, what about the now? I think the EU in the social field is focusing a lot on, let's say, the more long-term, the medium term, that's important, but how can we also support our sector in the emergency? Because as we have heard a lot, the crisis is now. Thank you very much.
Thank you very much, Tom. Thank you for collecting all this information and for analyzing it. It is very important that we have this type of reports. And of course, we will use this material in our communication with the European institutions and also in our communication with national authorities. Also, the members are encouraged to use this material when communicating to their own national or regional authorities. It is important that, as said by the representative of the Commission, that we also work with the local level, with the national level, and the media to generating awareness of the situation in our sector. Let's now look at different subsectors of the wide sector that we represent. We have lined up a few colleagues from different corners of Europe, so to say, that will briefly address issues in different types of services that we represent as a European organization. And it's with pleasure that I hand over to Pep Soler now. He's Managing Director of Support Catalonia in Spain. And Pep, I would like to hear from you what is needed to ensure care and community living services can stay active and can keep on providing quality support. Pep, you have the floor.
Thank you very much, Luke. Thank you very much to all the speakers before. I don't know if I can share the screen just to ensure that everybody can read if I miss something. But the first thing I want to say is that some of the main problems that we have perceived during the pandemic comes from before. We are absolutely impacted by the lack of investment in deinstitutionalization and the lack of investment in personalized support. And that has made consequences during the pandemic. We can make a provision that the risk of prevalence to be infected by COVID, if you live in a residential setting, is 500% higher than the rest of the population. This is something that is not fair. We cannot accept that without claim for a new scheme of providing long-term care and intense long-term care services to the people that are in need. There has been always excuses to don't invest in that deinstitutionalization, and we expect that the new recovery plans will not invent new excuses to face that challenge we have ahead. For the rest of the people, but because we have people living in residential settings that are still living in sort of lockdown for 7 months, because even before this second wave, they have been living in bubbles, not interacting with the community or with their friends or family. And this is something that clearly makes them more vulnerable to don't respect their rights of mobility and social involvement. During the pandemic, we have faced, of course, that many people, due to the service that has closed and the lack of alternative support in their homes when they are lucky to live with enough family support. There is a physical vulnerability, emotional vulnerability, of course, but the risk has been increased when there has been some obstacles to enjoy the mainstream health services. Collapsed for everybody, but in some cases with more lack of access for persons with disability, moreover, when you are living in residential settings. There will be other people talking about the financial vulnerability and the unemployment that has impact strongly in the disability sector. We have
1 more minute, Pep. Is that okay?
Yeah. And we have to ask for new, of course, flexibility of the public administration to providing services and compromise to transform long-term care resources to a more community-based, personalized support. This is something that cannot be dismissed. We have 12 years from the UN CRPD, Article 19, and 10 years from the Spitler report talking about DI, and there is no DI investment in any place in Europe strongly to say that we are doing something. Without that, next wave or next pandemic will impact at the same level for the people with disabilities that live in residential settings, suffering more than the rest.
Thank you very much, Pep, for your overview. Thank you also for these slides. And of course, we will make this material available to all participants because there are also some interesting figures on the slides. From community living and living integrated in society, we move to employment. And for employment, we have Catherine Volker with us. She's the managing director of BAG Germany. Catherine, please, you have the floor.
Hello, everyone. Even before the Corona crisis, the people with disabilities had difficulties finding jobs and employment. And this situation has been worse now during the crisis, and I fear that it will be even worse in the future due to the whole economic situation and the impact of the crisis on the economic situation. I think, therefore, it is very crucial to demand now that the rights of people with disabilities to work and to have access to employment must be considered in the national and in EU legislation in response to the crisis. During the so-called first wave of the crisis, we had in a lot of member states of the European Union the situation that employment services have been shut down totally due to the first lockdown. But the people with disabilities still needed support and needed to be enabled to cope with the crisis. And I think that is a very, very important aspect during this crisis. There's still this need for support. And hopefully in this so-called second wave, the employment services will remain open as they are right now. And they will be considered being working place as all the other enterprises are. And if they have, which I'm quite sure they have all over Europe, implemented hygiene measures, that the work can go on, because work is such an important aspect of every people's life. Doesn't matter of people with or without disabilities. A lot of the aspects I'm going to mention has been mentioned before, but I think they're very critical in this situation right now and very important. The financial situation of service providers, especially now in my perspective for employment services and providers of these services. In the first wave, the financial support has been going on quite well, not everywhere in Europe, but quite well in most of the countries. But we fear that there will be not as much support the longer the crisis will take place. And it is very important that there will be a good financial situation for all these service providers. We know that some so-called inclusive enterprise and even sheltered workshops in Europe are in danger of bankruptcy already because due to the economical crisis. We know that a lot of the employment services, especially regarding supported employment, have a lot of problems placing people in supported employment at the moment now into firms and enterprises because of the also already mentioned generalization of people with disabilities being part of the so-called risk group. And I think that's just not, there's no justification for this generalization.
1 minute, Catherine.
And I think there must be, this must stop. And hopefully, just to conclude, the value of work for all people needs to be recognized during this crisis and also in the future. There needs to be a financial stability for the service providers, and most important, all the people with disabilities who are working, doesn't matter on the open labor market, in sheltered employment, in supported employment. The European institutions and also on the national level, they must make sure that they are still gaining money, that they are still getting their remuneration as everybody else does in short-time compensation or other instruments. Thank you very much.
Okay, thank you very much, Catherine, for this very clear report, identifying a few really very challenging issues there. Successful employment is the result of successful education. So let's turn to the education field. Annemie Jennis from Flanders, Belgium, please share with us what special education needs mean in COVID-19 times. Annemie, you have the floor. You're muted, Annemie. You're muted.
Me.
Okay.
Thank you very much. Can I just share one screen, please? Is that possible?
Yes, that is possible.
Okay.
Okay, please.
So what have we learned? We have learned a lot from the first wave. First of all, schools need to stay open. Why? We had a closure of 6 months, 2 months starting from March until June and 2 months of holidays. For some children, schools reopened, but for a lot of them, they stay closed. A study of the University of Leuven showed that we have 6 months of learning delay. So we are very afraid for a lost generation. We don't want that to happen. Schools needs to stay open. Why? Because of this academic learning, but also because of social learning, the live contact with teachers. And that's, I hope that the person of the European Commission is still listening, because I plead that teachers will also get priority for the vaccine, because they are really, really important. We have 2 studies about the impact of Corona on children with special needs. One showed them that the distance learning is for a lot of these children much more difficult. We also experienced in a very recent study that, we go back to the medical deficit thinking about handicap and special needs. A lot of teachers are afraid that these children with special needs are more contagious, that they cannot apply the rules, and they are much more often kept at home. And again, we are afraid of a delay in academic learning, but also in social learning. Parents and children also experience a lot of loneliness and anxiety. Loneliness because they are afraid to ask for individual consultation about the learning process of their child. The schools are so busy with the Corona crisis, and of course that is normal. But very often there is no time left to think about a reasonable accommodation for these children. Schools have no clear expectations, and there is also a lot of anxiety to go back to school, anxiety about the evaluation procedure, about the adaptations, and about the individual curriculums. That is also why I plead that support teachers can go to the mainstream education schools. Please allow them in the schools, because they can make a difference for the children with special needs and also for the teachers who teach them. And finally, we see now that more children go back to special schools. I cannot say that this is due to the Corona crisis, but we just see that the numbers of children that go back to special education, that they increase. In the first wave, also special schools were closed. Now we really try to get them, to keep them open. All the schools were open in September. Now we had 2 weeks of holidays, 1 week longer than normally due to the Corona crisis. All the special schools go reopen, and we hope that they can stay open, because for these children also learning at a distance is a lot more complicated. So that's my contribution to this webinar.
Thank you very much, Annemie. Indeed, education is key to full participation in society, taking part in the labor market and being an active and valued citizen. So thank you for your reports. Let's turn to early childhood intervention. We all know that early childhood support and family support is absolutely essential if we want to avoid institutionalization of children, if we want to avoid that children are put on a sort of a negative track at the very start of their life. So it is with pleasure that I hand over to Dr. Vasilka Dimoška from Poraca, North Macedonia now, with some data and ideas with regard to the impact of the second wave on this type of services. Vasilka, you have the floor.
Thank you, Luke. The lockdowns caused by the virus has presented specific challenges for support of young children and their family. In this situation of pandemia, we as a service providers, we are taking different actions and in order to be able to continue the provision of essential care and support of services for those who need it the most. Unfortunately, in this situation, when the health sector is overloaded, there is an evident anxiety of the staff in our sector, but also anxiety of the parents of children with development needs and disability. There is a there is a need for extra training of professionals who are working in the field of early childhood intervention. There is with children in need, but also with their parents. The main challenge is the need to invest in knowledge and skills of parents how to work with their own children at home directly. Many of the service providers have financial difficulties as in every sector, especially in providing personal protective equipment and disinfection. Our concerns are need for a flexible and innovative model, including combination of face-to-face work and online work with children and parents. But all this requires additional training and assignments of the professionals. Direct work with children, according to the current protocols, require extra budget for disinfection and materials. So this reduce the daily, also this reduce the timing for daily capacity to direct work with children. The extraordinary cost of protective equipment and lack of assistance require most of the service providers to review the planned budget and to redirect money to the priority measures, measures for prevention. Unfortunately, this reduced the possibility for investment in training and qualification of the staff or possibility to increase the salaries of the staff. In the long term, this online work is a potential risk for the professionals to lose the opportunity to have effective and objective feedback in assessment of the needs of the child. This online work model is not effective for all children in need, but also for the families. Unfortunately, some of the parents do not have the opportunity to be part of the online work, to be part of the different online platforms, and to be more active in their work directly with the children at home. Moreover, this online work is a very high risk for socialization of the children. We have to give opportunity to have a direct work in group, not only face-to-face individual work with the child.
Mm-hmm. Can you conclude, Vasilka?
Yes. If we have in mind that a lot of in a lot of countries in Europe, there is a lack of legislative framework for early childhood intervention services. The situation is alarming. In combination with the COVID crisis, the sustainability of the existing service in high risk, but on the other hand, it is blocked the reform, the development of new type of services, the network of services for the early childhood intervention is alarming. Okay. Thank you.
Thank you very much, Vasilka, for your report. You are from North Macedonia, but of course your report is about much more than just North Macedonia. This situation for early childhood intervention support services goes across the board, across the European continent. Active participation in society is not only taking part in the employment life. It is not only about education. It is not only about living in the community. It's also being active in that society as a cultural actor, being actively involved in arts and in cultural participation. And therefore, it is with pleasure that I hand over now to Owen Nash from the Cope Foundation Ireland, who is leading our task force, our permanent working group on arts and cultural participation. Owen, you have the floor.
Thank you very much, everybody, and thank you for your time this morning. I'm going to begin with a poem that came to my attention after a piece called Ghosts. And after World War I, many people with disabilities became ghosts. And I wonder, what is the impact of this pandemic now? The poem, copyright of Sigrid Sassoon, reads as such. Does it matter losing your legs? For people will always be kind. And you need not show that you mind when the others come in after hunting to gobble their muffins and eggs. Does it matter losing your sight? There's such splendid work for the blind, and people will always be kind as you sit on the terrace remembering and turning your face to the light. Do they matter, those dreams from the pit? You can drink and forget and be glad, and people won't say that you're mad, for they'll know you've fought for your country, and no one will worry a bit. Are we at risk of leaving behind and ensuring that persons with disabilities across the European Union will be ghosts? Are we neglecting our responsibilities through funding? The implementation of the UN Convention of the Rights for Persons with Disabilities that we are signatories to, is it being upheld? Are we creating the ghosts? Just as what was done with persons with disabilities who returned from the wars, who became sidelined and marginalized and their voices marginalized, are we doing the same now? I wonder, in my area, the implementation of the UN Convention of Rights for Persons with Disabilities, in particular, Article 30 of that, cultural participation, access to museums, access to culture, the development of creative thinkers for solutions. How are we supporting people to be able to engage with their own creativity and their development? We heard earlier about the access to, about best practices, that we need to raise visibility. How do parents at home who are caring for their adult children give up more of their time to raise visibility of issues? They are exhausted. How do support services who are at the end of their, who are lacking staff support, who lack funding and investment, how are they able to support? We are becoming ghosts. And I suggest that this is not the first time that this happens in history when crises begin. This is a repeated pattern of marginalizing citizens with disabilities across the European Union. And we must do better as signatories to the UN Convention of the Rights for Persons with Disabilities. Thank you.
Thank you very much, Owen, for this very powerful message. As most of you know, yesterday, the 11th of November, we had many ceremonies in Belgium and in many other countries, remembering the end of the First World War. For the first time ever, this was organized at the main gate in Ypres without public. The last post was performed one person only to remember this horrible First World War. Thank you for making that link, because the reality indeed has some, well, there are some similarities, and we should join forces to make sure that indeed we try to break this ban and this so-called ghost situation. We have a few minutes left for a few questions. Only, sorry, I messed up the time schedule a little bit, but I thought that it was important to allow people to speak. So if we have questions, please feel free to launch them in the Q&A or in the chat box. In the meantime, I would like to ask James Churchill to come in very briefly. Maybe you could give us an update on what is happening with the workforce. Many people talked already about the workforce, but are there overarching issues, James? Can you come in? No, we obviously, there seems to be a sort of an internet problem there.
I can now.
Okay, James, please.
I've just been promoted to being a panelist.
Very briefly, James.
Very briefly, the one encouraging thing that seems to be coming out of this is an increasing recognition at European level that more needs to be done to support the development of staff in our sector. We're not there yet, but I begin to see the first few beams of sunlight coming through as they recognize that we really cannot continue as we are now with a sector that is underfunded and underpaid and has a very low status. And the more noise that we can make now as a sector about the difficulties that people with disabilities face and what needs to be done about it, the better it will help us later on.
Thank you very much, James. And indeed, we are working together with other organizations on making sure that workforce issues, the professionals in the sector, that the issues are understood also here at European level. There is a question in the chat box, no, in the Q&A for Annemie. Would it be possible to make these studies available, Annemie, or are these studies in Flemish, in Dutch only?
These studies are in Flemish, unfortunately. And the last one is not published yet, but I'll look it up. Maybe there is an English resume.
Yeah, there might be an executive summary in English.
I will look for it.
Okay. To all the members, maybe that is helping as well. Also, the knowledge team of ESPD is reviewing all the material that we received from you. Thank you for that. On how you deal with the crisis, easy to read material and so on. And we will make it again available so that everybody across Europe can benefit from what you developed in your organization, with your colleagues, with your family groups, user groups, and so on. So we will try to make that material available. There is also a question with regard to the EU funds for our sector. There I can share with you some good news. It still has to materialize, I know, but we have an agreement with the European Commission to set up a help desk for our sector, a help desk that would help service providers to have better access to the EU funds, so that we try to cut out a bit of the bureaucracy there, and that we make access easier to the funds that were discussed with the representative of the Commission, also REACT-EU and others. So we are working on the development of a help desk, and most probably we will go in a sort of a test phase in the coming weeks with 2 or 3 countries to make sure that we also learn more from what you really need at your end. So we are working on that. Those that are following the chat box can see that Owen also shared a link to that wonderful piece of literature poem that he shared with us. So please feel free to visit that website. Do we have other remarks or questions? Then I don't see questions. I go back to the Q&A for last time. No. Then I would like to hand over to one of the ESPD's vice presidents, Karin Asteger, for concluding remarks. Before handing over to Karin, I would like to inform you that we will launch a press release later on today, capturing the most important messages from this webinar. And also internally here with the colleagues in the office, we have planned, like we did before the summer, we planned the organization of a set of webinars again. Every 14 days, I think we will have a webinar that will look at different aspects of this corona crisis. So from our side, we hope that this will help you in your service, in your organization, to provide high quality support to people with support needs. And please feel free to inspire us, to bring up topics, to send us material or links to important material that can be used by your colleagues wherever in Europe. Karin Asteger from Austria, Vice President of ESPD. We're all yours for concluding remarks.
Thanks, Luc. And thank you, everybody, for this important and urgent debate that we had this morning. The panelists shared with us their experiences and stories, and this put at the center of attention the concrete challenges, struggles, and pressing issues that we have to solve at the moment. They also pointed out what good practices they developed, even despite of the difficult situations. The ESPD Snapshot report, of course, cannot provide a complete picture, but it collected and condensed experiences across Europe that gave us a clear picture of the challenges, possible solutions, and what has to be done by the authorities at all levels in the months and years to come. And Colin Cicluna from the European Commission, he confirmed the commitment of the Commission for this dialogue with our sector, for communication and cooperation. He expressed the strong will to listen to where our most pressing needs are. And this gives us the opportunity to point out where the most pressing challenges are for us now, as Jim pointed out. They are not only in the future, they're also now, but we also have to look into the future. So let me just finish by sharing some thoughts with you that stayed most in my mind after today's debate. First of all, essential services for persons with disabilities are open and running. And as Tom pointed it out, that fills us with pride and respect, because it is very challenging in the current situation. And it is a big achievement that is largely due to the commitment and flexibility of service providers and their staff. And as Animi pointed out, for the school sector, it is essential that services stay open. And it is essential that certain services continue to be face-to-face, because she reported already a 6-month learning delay for persons with learning disability after the lockdown this spring. So we saw from what we heard that this effort, this achievement is not sufficiently recognized. We were told there was a lack of visibility, but Owen pointed out that it is very difficult to strive for more visibility on top of everything that is being done under difficult circumstances. We heard from many sides, from Tom citing the ESPD report, but also from Katrin or Vasilika, that some services are or will be actually in a dramatic situation and at risk of continuity because essential fundamental issues are not being solved, like sustainable funding or staffing. So we know that there have been problems already in the past due to austerity measures or unattractive working conditions, low payment in our sector, especially compared to the health sector. And there's also justified fear for future austerity measures for our sector, given the bleak economic situation. So I would say that these really fundamental issues, they have to be solved to guarantee continuity of our services. But nevertheless, there are also challenges on how to provide our services. Digitalization, for example, Animi or Basilica, they gave us examples that it's more difficult for persons with learning disability, this distance learning, or that there are also issues of loneliness and anxiety involved. And I think we are all aware that the digital divide for persons with disability was already existing before the crisis, and it's been exacerbated by these circumstances. So I think efforts have to be increased to combat the digital divide and provide solutions for the problems pointed out. Another pressing issues, and as Jim already said in the introduction, it's really some depressing for service providers who have tried to be human rights enablers and move forward with the UN Convention. But we feel ourselves faced on how to find the right balance between giving choice and control to persons with disabilities and at the same time ensuring health and safety. And we did observe, most of us, already a setback in terms of rights. We did observe already a remedicalization and a return to more traditional services. Animi said she wasn't sure whether more children in special schools is due to this, but we can also see it in other areas. So I think we must pay attention that efforts towards deinstitutionalization are not slowed down by that. And on the contrary, as Pep pointed out with his really appalling information or data, that persons living in institutions have a 500% higher risk for infection and for social isolation than other people. I think we must increase our efforts on deinstitutionalization because the COVID-19 crisis showed us that the disadvantages for persons living in these settings is even bigger in this crisis. As Catherine pointed out, also employment is a most pressing topic. It has always been difficult for persons with disabilities to enter the labor market and to support them to achieve that. But it is very probable that it will be more difficult than ever, given the bleak economic situation. So let me just finish with all these pressing issues in front of us. And with this webinar, we also wanted to stress the dialogue we have with the European institutions and to use it to solve the challenges for our sector. So I think there is a need by existing policy tools and by new ones to be developed. Many have been mentioned already in terms of funding, but also in terms of social policy initiatives. And I think it is important that all these tools take account the impact of the COVID-19 crisis for persons with disabilities. It is also important that we have widespread tools that are not limited to the so-called social corner. I also think it is important for more general policy tools that also Mr. Cicluna mentioned in the beginning, that they explicitly refer to persons with disabilities and the support services they need. And I think it is very important that policy tools from different areas are interconnected and they combine the efforts and increase the impact. So for example, I find it very important to connect the European education area with the disability strategy, which so far I cannot fully perceive. It is also important from my point of view to take use of the European semester, which is more rooted in an economic area of the European Union, and to tie tightly to the European pillar of social rights, but an effective one that also provides relevant and reliable data. And we really must base our measures and progress reports on these.
Okay.
So thanks again for the constructive dialogue, and I'm confident that it is able to influence relevant strategies and policy tools at European level. Thanks, Luc.
Thank you very much, Karin, for this summing up. Very clear messages, I think. I will not repeat them. I would like to thank all speakers. I would like to thank all those that brought very important information from their subsector of the social services sector. I would like to thank Dimitri and Tom, who did a lot of work in the background to organize all this. So thank you very much, dear policy manager, and Dimitri, who is responsible for the logistics around this. Thank you. Well done. And my concluding words are: more activities will be organized by us. We invite you to take part in it. And maybe most important at this stage is together we are stronger. So let's try to join forces, not only in explaining how we can keep on providing high quality support services, but also in bringing these messages to the relevant policy levels. And that is, as said by the representative of the Commission, absolutely essential if we want our voices to be heard. Thank you very much. See you in a few days from now at other events. And please, let's keep on working together. Bye-bye. Thank you.